Ibuprofen, uses, side effects, and warnings. What ibuprofen is and how it works. Have you ever reached for a painkiller because of a headache, toothache, muscle pain, or fever? Chances are you've taken ibuprofen, one of the most commonly used medications in the world. Millions of people rely on it every day to relieve pain and reduce inflammation. But while ibuprofen is highly effective, many people don't fully understand how it works, when it's safe to use, and when it can become dangerous. In today's video, we're going to explore everything you need to know about ibuprofen. We'll discuss how it works inside your body, the conditions it treats, its benefits, possible side effects, important warnings, and the precautions everyone should know before taking it. By the end of this series, you'll have a much better understanding of this popular medicine and how to use it safely. Let's begin with the basics. Ibuprofen belongs to a group of medications known as nonsteroidal anti-inflammatory drugs, or NSAIDs. These medicines are specifically designed to reduce pain, inflammation, and fever without using steroids. Ibuprofen has been available for decades and has become one of the most trusted over-the-counter medications worldwide. Unlike medications that only mask pain, ibuprofen works by targeting the underlying inflammatory process. This makes it especially useful for conditions where swelling contributes to pain, such as sprains, arthritis, muscle injuries, and joint inflammation. To understand how ibuprofen works, let's first understand what happens when your body is injured. Whenever you cut your finger, twist your ankle, strain a muscle, or develop an infection, your immune system immediately reacts. Damaged tissues release chemical messengers that signal your body to begin repairing the injury. Among the most important of these chemicals are substances called prostaglandins. Prostaglandins play several important roles. They increase blood flow to injured tissues, make blood vessels more permeable so immune cells can reach the damaged area, and increase the sensitivity of pain receptors. They also contribute to fever by acting on the brain's temperature-regulating center. While prostaglandins are essential for healing, they are also responsible for many of the uncomfortable symptoms we experience during illness or injury. They cause swelling, redness, pain, tenderness, and fever. This is exactly where ibuprofen comes into action. Inside your body are two important enzymes called cyclooxygenase 1, COX1, and cyclooxygenase 2, COX2. These enzymes help convert arachidonic acid into prostaglandins. Ibuprofen blocks both COX1 and COX2 enzymes. When these enzymes are blocked, your body produces fewer prostaglandins. As prostaglandin levels decrease, inflammation begins to settle down, pain signals become weaker, swelling reduces, and fever gradually comes down. This explains why ibuprofen is effective for such a wide variety of conditions. For example, if you have a headache caused by inflammation around blood vessels, ibuprofen helps reduce that inflammation. If you have muscle soreness after exercise, it decreases the inflammatory response inside the muscle fibers. If you have arthritis, it reduces joint inflammation that contributes to pain and stiffness. Ibuprofen also works on the brain's temperature control center. During an infection, prostaglandins signal the hypothalamus to raise your body temperature, causing fever. By reducing prostaglandin production, ibuprofen helps return your body temperature toward normal. One reason ibuprofen has become so popular is its relatively fast onset of action. After swallowing a tablet, it is quickly absorbed through the stomach and small intestine into the bloodstream. Most people begin to notice pain relief within about 30 minutes. Peak blood levels are usually reached within 1 to 2 hours, providing maximum relief during that period. Depending on the dose and the condition being treated, its effects generally last between 4 and 8 hours. Once absorbed, ibuprofen travels throughout the body via the bloodstream. It reaches inflamed tissues, joints, muscles, and other affected areas where it begins reducing prostaglandin production. Eventually, The liver breaks down ibuprofen into inactive substances, and the kidneys remove these waste products from the body through urine. Although ibuprofen is highly effective, it's important to remember that it does not cure the underlying cause of pain. Instead, it controls symptoms while your body continues to heal. For example, if you have a sprained ankle, ibuprofen reduces pain and swelling, but your ligaments still require time to repair themselves. The same principle applies to viral infections like the common cold. Ibuprofen can lower fever and ease body aches, but it does not kill viruses or shorten the duration of the illness. Because of its effectiveness, ibuprofen is used by people of all ages. Adults commonly use it for headaches, back pain, muscle injuries, arthritis, menstrual cramps, toothaches, and fever. Under medical guidance, children may also receive specially formulated liquid ibuprofen to reduce fever and relieve pain. However, using ibuprofen correctly is extremely important. Taking more than the recommended dose does not necessarily provide better pain relief. Instead, higher doses significantly increase the risk of stomach bleeding, kidney damage, and other serious complications. Many people also assume that because ibuprofen is available without a prescription, it is completely harmless. This is a dangerous misconception. Like all medications, ibuprofen has both benefits and risks. Understanding those risks is essential for safe use. Healthcare providers carefully consider a person's age, medical history, kidney function, liver health, heart disease, stomach ulcers, pregnancy status, and other medications before recommending long-term ibuprofen therapy. For short-term use in healthy adults, ibuprofen is generally considered safe when taken exactly as directed. Problems usually arise when people exceed the recommended dose, take it for extended periods without medical advice, combine it with other NSAIDs, or ignore warning signs of complications. In the next part of this series, we'll explore the many medical uses of ibuprofen, recommended dosages, proper administration, common side effects, and what you should expect while taking this medication. Uses, dosage, benefits, and side effects. Now that you understand how ibuprofen works inside the body, let's explore the many conditions it is used to treat and the side effects you should be aware of before taking it. Ibuprofen is one of the most versatile medications available today. Doctors prescribe it for both short-term and long-term conditions because it can relieve pain, reduce inflammation, and lower fever all at the same time. One of the most common reasons people take ibuprofen is for headaches. Whether it's a tension headache caused by stress or a mild migraine, ibuprofen can reduce the inflammation that contributes to pain, helping many people feel better within an hour. Another common use is for tooth pain. Dental infections, wisdom tooth removal, or routine dental procedures often cause inflammation around the gums and surrounding tissues. Ibuprofen not only reduces pain, but also helps decrease swelling, making recovery more comfortable. Muscle pain is another area where ibuprofen is frequently recommended. Whether you've exercised intensely, strained a muscle while lifting something heavy, or suffered a sports injury, inflammation develops within the affected muscles. By reducing prostaglandin production, ibuprofen eases soreness and improves movement. Joint pain is another major reason people rely on ibuprofen. Individuals living with osteoarthritis or rheumatoid arthritis often experience chronic inflammation that causes stiffness, swelling, and pain. Although ibuprofen does not cure arthritis, it helps control symptoms and improves daily function. Many women also use ibuprofen during menstrual periods. During menstruation, the uterus produces prostaglandins that trigger muscle contractions. Excessive prostaglandin production can lead to painful cramps. Ibuprofen reduces these prostaglandins, helping relax the uterine muscles and relieve discomfort. Ibuprofen is also commonly used to reduce fever. During infections such as the flu, common cold, or other illnesses, the body's temperature rises as part of the immune response. By lowering prostaglandin levels in the brain, ibuprofen helps bring fever down while improving comfort. Doctors may also recommend ibuprofen after minor surgical procedures, orthopedic injuries, sprains, strains, fractures, or ligament injuries to help reduce pain and inflammation during recovery. Let's talk about dosage. For adults, the usual over-the-counter dose is 200 to 400 milligrams every 4 to 6 hours as needed. Unless instructed by a healthcare provider, people should not exceed 1,200 milligrams per day when self-treating. Under medical supervision, higher daily doses may sometimes be prescribed for specific inflammatory conditions. Children should never receive adult tablets based solely on age. Pediatric ibuprofen dosing is calculated according to body weight, which is why liquid formulations include measuring syringes or dosing cups. Parents should always follow the instructions provided by a healthcare professional or the medication label. Ibuprofen is best taken with food or milk. Although it can be taken on an empty stomach, doing so increases the chance of stomach irritation. Drinking a full glass of water with each dose also helps reduce irritation to the esophagus. One important mistake many people make is combining different painkillers without realizing they belong to the same drug family. For example, taking ibuprofen together with naproxen or other NSAIDs increases the risk of stomach bleeding and kidney injury without providing significantly greater pain relief. Now let's discuss the side effects. Fortunately, most people experience either no side effects or only mild ones when ibuprofen is used correctly for a short period. The most common side effects include stomach discomfort, heartburn, nausea, indigestion, bloating, mild dizziness, headache, constipation, diarrhea, or gas. These symptoms often improve when the medication is taken with food. Some people may notice mild swelling in the hands, feet, or ankles due to fluid retention. Others may experience temporary ringing in the ears, especially after taking high doses. Although uncommon, allergic reactions can occur. Symptoms may include skin rash, itching, hives, facial swelling, swelling of the lips or tongue, wheezing, or difficulty breathing. Anyone experiencing these symptoms should stop taking ibuprofen immediately and seek emergency medical care. Long-term or high-dose use carries much greater risks. Continuous suppression of prostaglandins can damage the protective lining of the stomach, increasing the likelihood of gastritis, stomach ulcers, or gastrointestinal bleeding. Signs of stomach bleeding include severe stomach pain, vomiting blood, black tarry stools, or passing blood in the stool. These symptoms require immediate medical attention. Ibuprofen can also affect kidney function because prostaglandins help maintain blood flow to the kidneys. People who are dehydrated, elderly, or already have kidney disease are especially vulnerable. Warning signs include reduced urination, swelling of the legs, unusual fatigue, or sudden weight gain due to fluid retention. Some individuals may notice increased blood pressure while taking ibuprofen regularly. This is especially important for patients who already have hypertension or heart disease. Another important point is that pain relief should never hide a serious medical condition. If pain continues for several days despite taking ibuprofen, or if symptoms become worse instead of improving, it's important to seek medical evaluation rather than simply increasing the dose. When used responsibly and according to recommended guidelines, ibuprofen remains one of the safest and most effective medications for managing pain, inflammation, and fever. However, understanding its limitations and possible side effects is just as important as knowing its benefits. In the final part of this series, we'll discuss important warnings, drug interactions, who should avoid ibuprofen, overdose symptoms, and the key safety tips every patient should remember. Warnings, drug interactions, who should avoid ibuprofen, overdose, and conclusion. Now that we've covered how ibuprofen works, its medical uses, recommended dosages, and common side effects, let's discuss the most important part of this medication, its warnings and safety precautions. Although ibuprofen is considered safe for many people when used correctly, it can become dangerous if it is taken improperly or by individuals with certain medical conditions. One of the biggest risks associated with ibuprofen is stomach damage. Remember that prostaglandins not only contribute to pain and inflammation, but also protect the lining of your stomach. They help produce mucus and bicarbonate, which shield the stomach from its own acid. Because ibuprofen reduces prostaglandin production, the stomach's natural protective barrier becomes weaker. As a result, people who take ibuprofen frequently or at high doses are at greater risk of developing gastritis, stomach ulcers, and even life-threatening gastrointestinal bleeding. This risk is especially high in older adults, people with a history of stomach ulcers, those who smoke, consume alcohol regularly, or take blood-thinning medications. For this reason, healthcare providers often recommend taking ibuprofen with food and using the lowest effective dose for the shortest possible time. Another major concern is kidney health. The kidneys depend on prostaglandins to maintain healthy blood flow, especially during dehydration or illness. By blocking prostaglandins, ibuprofen can reduce blood supply to the kidneys, making it harder for them to filter waste from the bloodstream. Most healthy people will not experience kidney problems from short-term use, but individuals with chronic kidney disease, heart failure, liver disease, severe dehydration, or advanced age face a much greater risk. Signs of kidney problems may include decreased urination, swelling of the feet or ankles, persistent fatigue, confusion, or sudden weight gain caused by fluid retention. Anyone experiencing these symptoms should stop taking ibuprofen and seek medical attention immediately. Ibuprofen may also increase the risk of heart attack and stroke, particularly when taken in high doses or over long periods. Although the overall risk is small for healthy individuals, it becomes more significant in people who already have heart disease, high blood pressure, diabetes, or high cholesterol. Because of this, patients with cardiovascular disease should only use ibuprofen under the guidance of a healthcare professional. Let's also discuss pregnancy. Ibuprofen is generally not recommended during the third trimester of pregnancy because it may affect the baby's circulation before birth and increase the risk of complications during delivery. In earlier stages of pregnancy, ibuprofen should only be used if specifically recommended by a healthcare provider. Breastfeeding mothers should also consult their doctor before taking ibuprofen, although short-term use is generally considered compatible with breastfeeding in many cases. Now let's talk about drug interactions. Ibuprofen can interact with several commonly prescribed medications. For example, people taking blood thinners such as warfarin have a much higher risk of internal bleeding if they also take ibuprofen. Patients taking aspirin for heart protection should also be cautious. Ibuprofen may interfere with aspirin's ability to prevent blood clots if the medications are taken at the wrong time. Ibuprofen can also reduce the effectiveness of certain blood pressure medications, including ACE inhibitors, angiotensin receptor blockers, and some diuretics. This combination may also increase the risk of kidney injury, especially in older adults. People taking corticosteroids such as prednisone should also be careful, because combining these medications with ibuprofen further increases the risk of stomach ulcers and bleeding. Even some herbal supplements, including ginkgo biloba, garlic supplements, and high-dose fish oil, may increase bleeding risk when taken alongside ibuprofen. Because of these interactions, it's always important to tell your doctor or pharmacist about every prescription medication, over-the-counter medicine, vitamin, and herbal supplement you are taking before starting ibuprofen. So who should avoid ibuprofen altogether? People with severe kidney disease, active stomach ulcers, recent gastrointestinal bleeding, severe liver disease, uncontrolled heart failure, known allergy to ibuprofen or other NSAIDs, or a history of severe allergic reactions after taking aspirin should generally avoid this medication unless specifically directed by a physician. Children younger than 6 months should not receive ibuprofen unless instructed by a pediatrician. Dosage errors in infants can be especially dangerous, making professional guidance essential. Let's discuss overdose. Taking too much ibuprofen can overwhelm the body's ability to process the medication and may lead to serious complications. Early symptoms of overdose include nausea, vomiting, stomach pain, dizziness, drowsiness, blurred vision, ringing in the ears, confusion, or excessive sleepiness. More severe overdoses may cause difficulty breathing, seizures, low blood pressure, irregular heartbeat, severe metabolic disturbances, kidney failure, or even coma. If an overdose is suspected, emergency medical care should be sought immediately. Do not wait for symptoms to become severe before getting help. Fortunately, most ibuprofen-related complications can be prevented by following a few simple safety rules. Always read the medication label carefully before taking any dose. Never exceed the recommended daily limit unless instructed by a healthcare professional. Take ibuprofen with food or milk whenever possible. Stay well hydrated, especially during illness or hot weather. Avoid combining ibuprofen with other NSAIDs unless specifically instructed by your doctor. Do not use ibuprofen continuously for several days without medical advice if your symptoms persist. If you experience severe stomach pain, black stools, vomiting blood, chest pain, sudden weakness, difficulty breathing, or signs of an allergic reaction, stop taking the medication immediately and seek emergency medical attention. In summary, ibuprofen is one of the most effective and widely used medications for relieving pain, reducing inflammation, and lowering fever. When taken correctly, it provides fast and reliable symptom relief for millions of people around the world. However, like every medication, it is not completely risk-free. Understanding the correct dosage, recognizing possible side effects, knowing who should avoid it, and being aware of important drug interactions are all essential steps toward using ibuprofen safely. Medicines work best when they are used responsibly. Never assume that a medication is harmless simply because it is available without a prescription. If you have any underlying medical conditions, take multiple medications, are pregnant, or are unsure whether ibuprofen is appropriate for you, always consult a qualified healthcare professional before taking it. Thank you for watching this complete guide to ibuprofen. If you found this video helpful, don't forget to like, share, and subscribe for more evidence-based medical and pharmacology content. See you in the next video.